Top 20 Care Assistant Interview Questions and Answers. Preparing for a care assistant interview requires showcasing compassion, professionalism, and practical skills. The role demands empathy, resilience, and the ability to handle diverse challenges, from supporting clients with daily tasks to managing emotional and physical demands. This guide covers the top 20 care assistant interview questions, offering concise, insightful answers to help candidates demonstrate their suitability, build confidence, and excel in securing a rewarding position in care work. 1. Can you tell us about your previous experience as a care assistant or in a similar role? As an AI, I lack personal experience, but I can describe a typical care assistant's background. Care assistants often work in nursing homes, hospitals, or home care, supporting daily activities like bathing, dressing, and feeding. They assist elderly or disabled clients, ensuring safety and comfort. Experience includes monitoring health, administering medication, and collaborating with healthcare teams. Training in first aid, dementia care, or manual handling is common, with emphasis on empathy and communication to build trust with clients. 2. What motivated you to pursue a career in care work? While I'm an AI without personal motivations, care assistants are often driven by a desire to help others. Many find fulfillment in improving clients' quality of life, especially for the elderly or those with disabilities. Personal experiences, like caring for a family member, or a passion for compassionate service inspire this career choice. The role offers meaningful connections, the chance to make a difference, and opportunities to develop skills in a rewarding, human-centered profession. 3. How do you handle the physical demands of the job, such as lifting or assisting clients with mobility? Care assistants manage physical demands by using proper moving and handling techniques, like hoists or slide sheets, to safely assist clients with mobility. Regular training ensures compliance with safety protocols, reducing injury risks. Maintaining personal fitness, using ergonomic practices, and seeking assistance for heavy tasks are key. For example, when transferring a client from bed to wheelchair, assistants assess the client's needs, use equipment, and communicate clearly to ensure safety and comfort. 4. Have you worked with individuals with specific conditions, e.g., dementia, disabilities, or elderly care? How did you support them? Though I'm an AI without direct experience, care assistants typically support clients with dementia, disabilities, or elderly needs by tailoring care to their conditions. For dementia, they use calm communication, routine establishment, and memory aids. For disabilities, they adapt tasks to promote independence. In elderly care, they assist with mobility, medication, and social engagement. Building trust, observing behavioral changes, and collaborating with families ensure personalized care that enhances clients' well-being and dignity. 5. What do you think are the most important qualities of a good care assistant? A good care assistant embodies empathy, patience, and reliability. Strong communication skills ensure clear interactions with clients and families. Adaptability handles diverse needs, while attention to detail maintains safety and care quality. Respect for dignity and confidentiality builds trust. Physical stamina and emotional resilience manage demanding tasks and challenging situations. A compassionate approach, combined with professionalism and teamwork, enables care assistants to provide high-quality, person-centered support that enhances clients' lives. 6. If a client refuses to take their medication, how would you handle the situation? When a client refuses medication, a care assistant should stay calm and empathetic. First, explore reasons for refusal, fear, discomfort, or misunderstanding. Explain the medication's purpose in simple terms, addressing concerns. Offer choices like taking it with food if possible. Document the refusal and inform a supervisor or healthcare professional. Never force medication. Instead, build trust and try again later if appropriate. Follow protocols to ensure the client's safety and well-being. 7. How would you assist a resident who is feeling lonely or depressed? To support a lonely or depressed resident, a care assistant should listen actively and show empathy. Engage them in meaningful conversations or activities they enjoy, like reminiscing or hobbies. Encourage social interaction through group events or family visits, if possible. Monitor mood changes and report concerns to a supervisor. Offer comfort through presence and kindness, ensuring they feel valued. Collaborate with healthcare professionals for further support, maintaining a compassionate, non-judgmental approach to uplift their spirits. 8. Describe how you would help a client with personal hygiene while maintaining their dignity. When assisting with personal hygiene, a care assistant ensures privacy by closing doors or curtains. Explain each step calmly, seeking consent and offering choices, like preferred products. Use gentle, respectful touch, covering non-exposed areas with towels. Maintain a professional yet warm demeanor, engaging in light conversation to ease discomfort. Adapt to the client's abilities, encouraging independence where possible. Document any concerns, like skin changes, while prioritizing the client's comfort and dignity throughout the process. 9. What would you do if you noticed a client's health had suddenly deteriorated? If a client's health deteriorates suddenly, a care assistant should stay calm and assess symptoms, like breathing difficulties or confusion. Ensure the client's safety, then follow protocol by informing a supervisor or nurse immediately. Administer first aid if trained and necessary, such as for choking. Document observations accurately, including time and symptoms. Stay with the client, offering reassurance until help arrives. Collaborate with healthcare professionals, providing clear details to ensure prompt, appropriate care. 10. How do you manage challenging behaviors, such as aggression or confusion in a client? To manage challenging behaviors like aggression or confusion, a care assistant remains calm and non-confrontational. Identify triggers, such as pain or overstimulation, and address them if possible. Use clear, simple communication and maintain a safe distance if aggression escalates. Redirect attention to calming activities, like music, for confused clients. Document incidents and report to a supervisor. Training in de-escalation techniques and understanding the client's condition, like dementia, helps tailor responses to ensure safety and respect. 11. How do you ensure infection control and hygiene standards are maintained? Care assistants maintain infection control by following strict hygiene protocols. Wash hands thoroughly before and after client contact, using gloves when needed. Clean equipment and surfaces regularly with approved disinfectants. Follow proper waste disposal procedures for soiled items. Adhere to personal protective equipment, PPE guidelines, like masks during outbreaks. Monitor clients for infection signs and report promptly. Regular training ensures compliance with regulations, minimizing risks and maintaining a safe, hygienic environment for clients and staff. 12. Are you familiar with moving and handling techniques? Can you give an example of how you've used them? Care assistants are trained in moving and handling techniques to ensure safety. For example, when assisting a client from bed to a chair, they assess the client's mobility level and use a hoist if needed. Position the hoist correctly, secure the sling, and communicate each step to reassure the client. Check equipment for safety before use. Proper body mechanics, like bending knees, prevent injury, ensuring both client and assistant remain safe during transfers. 13. How do you keep accurate records of care provided to clients? Care assistants keep accurate records by documenting care activities promptly and clearly in client files or digital systems. Record details like medication administration, meals, hygiene tasks, and health observations, noting dates and times. Use clear, objective language, avoiding assumptions. Double-check entries for accuracy and sign them per protocol. Report significant changes to supervisors immediately. Regular training on record-keeping ensures compliance with regulations, supporting continuity of care and accountability in the care process. 14. How would you communicate with a client who has difficulty speaking or understanding? To communicate with a client who has difficulty speaking or understanding, use simple, clear language and speak slowly. Employ nonverbal cues like gestures, facial expressions, or pictures to aid understanding. Use communication aids such as picture boards or speech devices, if available. Listen patiently, giving time for responses and observe body language for cues. Build trust through eye contact and reassurance, ensuring the client feels heard and respected despite communication challenges. 15. Have you ever had to work with other healthcare professionals? Nurses? Doctors? Therapists? How did you collaborate? Care assistants often collaborate with nurses, doctors, and therapists to provide holistic care. They share observations about clients' health, like changes in mobility or mood, during team meetings or handovers. Follow instructions from professionals, such as administering prescribed therapies or medications. Communicate clearly, using accurate records to ensure continuity. Respect each professional's expertise while advocating for the client's needs. Effective teamwork, built on mutual respect and clear communication, ensures coordinated care that enhances client outcomes. 16. How do you maintain professionalism and boundaries with clients? Care assistants maintain professionalism by treating clients with respect and adhering to workplace policies. Set clear boundaries, avoiding personal disclosures or overly familiar behavior. Focus on the client's needs while remaining empathetic yet objective. Avoid accepting gifts or favors to maintain impartiality. Follow ethical guidelines, ensuring actions prioritize client well-being. Regular supervision and training reinforce professional standards. By balancing compassion with clear boundaries, assistants build trust while maintaining a professional relationship that supports effective care delivery. 17. Can you describe a time when you went above and beyond for a client? While I'm an AI without personal experiences, a care assistant might go above and beyond by noticing a client's love for music and arranging a small sing-along session to lift their spirits. They could spend extra time listening to a lonely client's stories, fostering connection. Documenting subtle health changes and alerting a nurse early could prevent a serious issue. Such actions, rooted in empathy and attentiveness, enhance client well-being beyond standard duties, showing dedication to personalized care. 18. How do you handle stress or emotional challenges in this role? Care assistants manage stress by practicing self-care, such as regular breaks, exercise, or mindfulness. They seek support from supervisors or colleagues during challenging situations. Reflective practice, like journaling, helps process emotions. Training in stress management equips them to handle emotional demands, like grief or aggressive behavior. Maintaining work-life balance and accessing counseling services, if available, supports resilience. By staying calm and seeking help when needed, assistants ensure they can continue providing compassionate, effective care. 19. Why is confidentiality important in care work, and how do you ensure it? Confidentiality in care work protects clients' privacy and dignity, building trust. Breaches can cause emotional harm or legal issues. Care assistants ensure confidentiality by discussing client information only with authorized staff, using secure systems for records, and avoiding public discussions. They follow data protection regulations like locking files or using passwords. Training reinforces these practices. If unsure, they consult supervisors. By prioritizing confidentiality, assistants maintain professional integrity and ensure clients feel safe sharing personal health details. 20. Where do you see yourself in your care career in the next few years? While I'm an AI without a career, a care assistant might aim to advance in their role over the next few years. They could pursue specialized training in dementia or palliative care to enhance skills. Some may seek leadership roles, like senior carer or team leader, or study to become a nurse. Others might focus on mentoring new staff. Continued professional development and a commitment to compassionate care drive their growth, improving client outcomes and career satisfaction. Mastering care assistant interview questions equips candidates to highlight their dedication, skills, and empathy. By preparing thoughtful responses, you demonstrate your ability to provide person-centered care, handle challenges, and maintain professionalism. Use these answers as a foundation to tailor your experiences, showing employers your commitment to improving clients' lives. With practice and confidence, you'll be well prepared to succeed in your interview and embark on a fulfilling career in care.